Next question I'm going to direct to Ryan. What changes, interstate regulation, etc., to the existing insurance regulation can take place that would create more competition among insurance providers and give more choices to the patient? How would this affect access as well as cost?
That's another great question. And, you know, I feel like I'm going to give the stereotypical response. We need less regulation. You know, insurance companies, as much as they're being demonized, you know, the insurance concept has worked very well in this country. And there are many people who are having $100,000, $1 million claims paid all the time that they could never afford in and of themselves. So the concept of pooling risk in order to protect yourself against some unknown catastrophe, it works very well. In other types of insurance, we see all sorts of different kinds of policies and different types of products. But the health insurance industry is very tightly regulated. Between the insurance regulations and if you're an employer, to deal with this morass of regulations, you've got COBRA, OBRA, HIPAA, you've got the Internal Revenue Code, and the popular sections for most of the employers out there are 105, 125, 213, 401, 501. These numbers all have to be deciphered in order to operate a health plan, in order to put a product together and sell it. Now I look at our own shop, okay? We're a small employer for the most part. Nobody in our firm is going to have in vitro fertilization. But the price of our policy has about 1 to 2% increase in the rate because the state of Illinois has a mandate to cover in vitro fertilization. Wouldn't it be nice if we took away some of those mandates and regulations and allowed the insurers to separate the marketplace? People who want these benefits can pay for them. People who don't want them don't have to pay for them. That increases access to what mostly affects people. Accidents, coronary artery disease, cancers, chronic illness, it's the expensive things that they need to get covered. So we need to remove the regulation. It would also be nice to operate between states. You know, right now all 50 states have a State Department of Insurance and commissioners regulate the insurance per state. And that really has to do with the theme of states' rights. And it's not all bad that we do that, but some ability for insurance companies to operate across state lines in a little different way than they do today would help people compare and market different products. So we can remove some of that regulation. It would be very helpful. Reduce costs when costs